This is Charlotte Talks. I'm Mike Collins. On the local news roundup, COVID hospitalizations rise to record numbers with infections at their highest rate ever, but some believe we may be reaching a plateau. Tests are in short supply, but this week the Biden administration made moves to correct that, providing home tests and masks through a website. We'll tell you more. North Carolina's primary is delayed yet again. Now we will vote in June, most likely, as the state Supreme Court examines voting maps. The rollout of 5G adds to Charlotte Douglas's flight cancellation woes, and Michael Alvarez, mayor of Indian Trail, loses his battle with cancer. To take us through those stories and more, we welcome WFAE political reporter Steve Harrison. Good morning, Steve.
Hey, good morning, Mike.
Joe Bruno is a reporter for WSOC TV Channel 9. Joe, welcome back.
Good morning.
Seema Iyer becoming a regular guest on this program. She is the chief legal correspondent for WJZY Queen City News. Seema, welcome back to you.
Very lucky to be back. Good morning, guys.
You say reserve judgment on that. And Jonathan Lowe is here again. He's a reporter anchor for Spectrum News 1. Jonathan, good to see you.
Good morning, Mike.
New hospitalization records are being set in North Carolina because of the Omicron variant of the COVID-19 virus. The State Department of Health and Human Services says more people are in the hospital for COVID-19 right now than at any time last year across the state. As of yesterday, 4,741 people are in the hospital with COVID, a 16% increase over last year. And this week, Atrium reported that 156 people in their hospitals are on life support, and of those, 92% are unvaccinated. Dr. Katie Passaretti is an infectious disease physician and chief epidemiologist at Atrium, and she says the rise in cases is also affecting the health of healthcare workers.
1 in 3 people are testing positive. Our healthcare workers are impacted by that as well. So we're dealing with these high volumes of patients with healthcare workforce that's being impacted also with COVID infection out of work. So, it's a very tricky situation right now in all our facilities.
And the numbers, as I'm told, continue to grow. At least they will for a while, because positive test rates are rising across the state. Tests are showing a 31% positivity rate, as you just said, 1 in 3. Correct me if I'm wrong, but back when the governor was coming out weekly, almost talking about various things that we were going to do, depending on the testing rate and infection rate revealed by testing, the number that would lead us to get rid of masks and reopen businesses was well below this 31% positivity rate. And we almost reached that number. What was that goal, by the way? Does anybody know, Jonathan? Do you know?
It was somewhere between 5 and 7%. I want to go with 5%, but something tells me it was 7%. Mm-hmm. Either way, it was in the single digits.
And we almost reached that goal. It looked like we were going to reach that goal.
Right before Thanksgiving, if you remember, early November, late September, we had really dipped down low, and the conversation, at least in Mecklenburg County, had started to shift towards, are we getting closer to eliminating the mask mandate? Because that's the threshold is 5%. And I just recall Joe, he stays on the COVID updates. I remember him updating one particular week about what it will take and the discussions behind possibly getting to no mask mandate in Mecklenburg County, and then things where we are now.
Yeah, actually, I think it was on November 27th where there were no new cases reported, period. So we were really getting down there.
Yeah.
So can we say that this current surge, which is well above the numbers we're talking about now, is because of not only the Omicron variant, but also the fact that we've been through several holiday celebration seasons, and we're reaping the, I don't want to say rewards, but we're reaping the aftermath of that. Joe, would that be accurate?
Yeah, I think we were going to have a surge regardless because of the holidays. It's just Omicron, and its ability to be passed around more easily is making things worse.
Dr. Raynard Washington is Mecklenburg County's new health director. He replaced Gibby Harris, who retired at the end of the year, and he was sworn in on Wednesday. And he said at the time about 83% of current COVID cases in Mecklenburg County are the Omicron variant, but he says the rate of new cases is beginning to slow. And this morning in the Charlotte Observer, Katie Passaretti from Atrium also says she sees a plateau on the horizon. I believe, Jonathan, you were at that press conference of Raynard, Washington. Why is he anticipating a plateau, and when does he believe that might occur?
So he said a couple of weeks. I actually just went back and listened to it this morning because I wanted to make sure that he put out a lot of different things the other night, but a couple of weeks. And he said that what they're looking to as evidence that we might be approaching a plateau is other cities across the country that are already at that point. New York and Florida being the two that he highlighted. He said, when you look back, even as far as where Omicron originated in South Africa, when they plateaued, the decline was pretty rapid. And so they're seeing that in New York and Florida, which leads him to believe that we are about 2 weeks away from that, seeing that sort of plateau and then steep decline.
It's good news that we're starting to plateau, but a lot of times people think of it as a roller coaster, like Fury 325. We get to the top and all of a sudden we fall down, when in reality it's more like an escalator. And right now we're at the top of Nordstrom and we're going to wander around a little bit and then take a slow trip down again. So we're still going to have quite a few people testing positive for several weeks before we're really close to a good level of COVID in the community.
And the reason we're at the top of Nordstrom is because TJ Maxx only has one floor.
Yes.
I'm sorry. Go ahead, Jonathan.
I was just going to say, and the reason why is because hospitalizations are still an issue, and we know that that's a lagging indicator. And as you mentioned, Mike, hospitalizations and the number of people that are in the ICU is still really high. I remember Dr. Washington also mentioned that there's a growing number of people in the age range of 18 to 64 that are in the ICU. Which tells you that, as Joe just mentioned, we're probably going to meander a little bit at that plateau.
The reason some of our healthcare professionals here and elsewhere in the country see a decline in cases in our future and even plateaus in our very near future is because of what has happened elsewhere in the world. Here's the next question then. Once these places elsewhere in the world experience the plateau and then the decline in cases, what has happened after that? Have they gone back up? Have new variants emerged? Or is that the end of it?
Well, it seems like new variants have emerged, because after we were getting through Delta, and that's when we saw the downtrend back in the fall months around Thanksgiving, and then Omicron came up and it surged again. So who knows what will happen next, but it should be the conversation that we have to move towards thinking of this as a pandemic to an endemic and learn how we can actually live with it.
And I was going to say,
go ahead.
I was just going to say, I mean, so far with Omicron, like we said earlier, South Africa went through this first. They're still going way down. So no country has kind of gotten to a point with Omicron where they've gone down and then gone back up. That's not to say it won't happen, because that's what's happened in every other cycle in this pandemic. But we're still haven't seen that, how it's going to play out with Omicron yet, because South Africa cases are still going down.
Our testing efforts they're trying to make them go back up, and we'll talk about that in a moment. But at his swearing in, Dr. Raynard Washington with Mecklenburg County Health said that the county is scaling back its contact tracing efforts.
State is beginning to transition our case investigation and contact tracing to more of a sustainable approach.
What would that approach be?
Well, more than 17,000 people tested positive for COVID in Mecklenburg County in the past week alone. And Mecklenburg County has dozens of contact tracers maybe. So clearly it's impossible for them to reach all of these people anyway. So the contact tracing efforts that the county will undergo in the future will involve group settings, shelters, things along that nature, but really scaling it back, telling people who test positive, let your close contacts know. And it's the first step towards living with this virus and maybe approaching a more flu-like surveillance system.
I think it's because the contact tracing wasn't working, because back in July of 2020, Mecklenburg County had 25 full-time people doing this, 100 part-time people doing this. And Dr. Mandy Cohen said that of all the people that they were trying to reach, they would only get in touch with 1/3 to 1/2. So you're employing all these people and you're not getting the results. And again, that was pre-Omicron. So
And I understand this transition away from this managed approach to contact tracing is now going to move toward individuals. They're depending on us if we test positive to find out who we may have been around and contact all of those people that we've been around. Are people likely to do that on their own?
I don't know. I don't know. And I can't help but think that the fact also that people can do at-home tests and those are not reported also played into this decision of shifting away from contact tracing, because the Dr. Washington made the point of saying that it's the percent positivity rate that tells them the rate of infection and how prevalent it is in the community. It's not really the fact that we're having, as Joe mentioned, 17,000 new cases. That's not what is telling them what the virus is really doing in the community. So that, in addition to the fact that at-home tests, you do it at home, how often are people actually reporting those results? And not supposed to be reported in the first place.
So as we go ahead.
I was just going to say, I think we're in a better place now with people doing their own contact tracing, because the stigma of getting COVID, there are a lot more people who may not be embarrassed now that they got COVID than they may have been if they were earlier in the pandemic. So now people are, more willing to share with others they have COVID. And also, nobody's blind to the fact that COVID is everywhere right now, and that if you have symptoms, it's very likely COVID. So I think we finally reached that point where we can take this step, Mike.
But a lot of people are asymptomatic, meaning they have the virus, they're shedding the virus, they can give that virus to somebody else, but because they have no symptoms, they haven't tested and they don't know that they have it. And if you have that situation plus self-testing, which is going to become more and more available because of these kits being distributed by the federal government to individuals, and you remove governmental reporting on this and contact tracing, we're going to reach a point where we have no clue of the level of the virus in our midst. Is that not right?
I would argue we have no clue right now of the level of virus in our midst. The tests are impossible to find. The at-home test kits aren't being reported to the county. So, there's much more COVID out in the community right now than we know.
And they've said this from the beginning of the pandemic, from the very beginning, from March, April 2020, that COVID was being underreported in other countries as well as ours. So you're right. Yeah.
So the rise in the number of cases is impacting hospitals elsewhere far more than here. Oklahoma City this week reported that they had no beds available in their hospitals because of COVID. We aren't there, thankfully, but we've all been enduring this for 2 years. And Dr. Todd Davis, the chief physician executive at Caramount Health, was on this program this week and mentioned the emotional toll and the physical and mental fatigue being experienced by healthcare workers. He says they went into this field because they are compassionate people who want to help. They don't want to see suffering or loss. And now they are experiencing an onslaught of it day after day after day.
They are struggling with how to manage this onslaught and tidal wave of just sorrow. And everyone knows that a lot of it is preventable. And the prevention is so much easier than the cure or the treatment when people do get critically ill.
Something to think about as we go into the break. We'll come back and talk a little bit more about testing for this virus and then move on to other topics. There are other topics in the world. I found that out yesterday. We'll talk about them when we continue. Support for Charlotte Talks comes from WFAE members and Mazda of South Charlotte, pledging to help end child hunger in the Carolinas through ongoing support of Second Harvest Food Bank of Metrolina. Details about this initiative at Mazda of South Charlotte.com. Coming up Monday on this program, in the last decade, North Carolina's Latino population grew by about 40%. That's 5 times higher than the non-Latino population. At the same time, there is an underrepresentation of Latinos in the ranks of lawmakers. We have never elected a Latino congressperson from North Carolina. And only a few Latino members of the General Assembly have sat in the State House in Raleigh. Well, now new voting maps may lessen their chances of getting there in the future. And we'll look at that Monday on this program at 9.
Business development, closings, business disputes, changing neighborhoods. It's all packed into our weekly Bizworthy segment with Tony Messia of the Charlotte Ledger. There's also out of the ordinary business news.
We called 5 different pet groomers in Charlotte. The first 5 that we called rolled over into voicemail, said they weren't.
Catch Bizworthy every Thursday on WFAE's Morning Edition at 6:44 and 8:44. Support for Bizworthy is provided by Sharon View Federal Credit Union and our members.
It's Charlotte Talks and the local news roundup on listener-funded 90.7 WFAE and 90.3 WFHE. I'm Mike Collins. The 4 reporters on our panel this day: Jonathan Lowe, reporter anchor for Spectrum News 1; Seema Iyer, chief legal correspondent for WJZY Queen City News; Joe Bruno is a reporter for WSOC TV; and Steve Harrison is our political reporter here at WFAE News. We just heard from Dr. Todd Davis, who's the chief physician executive at Caramount Health, about what he described as the onslaught of cases of COVID in their hospital system, and the tragedy that these people have had to deal with, the healthcare workers have had to deal with day after day after day, and the emotional impact that is having on them. And the reason is for people because all the people in these hospitals, the vast majority, almost 90% of them or more, are people who chose not to become vaccinated. So given the resistance to the vaccines, the health experts believe that this is going to be our new reality until this virus somehow, if ever, burns itself out. And will it burn itself out? Has anybody spoken about that?
Well, so you're talking about Oklahoma City and how devastating it is there. All I can say is if you look at the data, at least in North Carolina, the hospitals here are in better shape because since December 12th, our ICU rates have dropped. Back in December 12th, we were at 27%. As of yesterday, we're at 17%. So it is getting better here. So I think it is a geographic issue. It depends on some place. And also this connects, of course, to the politics of vaccines. Oklahoma may be very different than North Carolina.
So because this vaccine is sticking around and we may be heading into this endemic version as opposed to a pandemic version of COVID, it also means that mask wearing is going to be with us for a longer period than most of us would like. But at this week's Mecklenburg County Commission meeting, Chairman George Dunlap made this point.
People in Mecklenburg County don't realize how lucky they are to only have a mask mandate.
Speaking of which, recommendations about which kinds of masks are effective recently changed when the federal health authority said that cloth masks do not provide sufficient protection against the Omicron variant, and that only N or KN95 masks are effective. And now the federal government has plans to ship more than 400 million N95 masks from the federal stockpile to distribution sites around the country. And I believe I'm right in saying that about 225 million of those masks are being manufactured by Honeywell, which is headquartered here in Charlotte. How will we, the public, get these masks and when?
So Dr. Washington said that those that they have not shipped, families will be able to go onto a federal website and request masks. You'll get 4 per household. But he did
masks?
4 masks. Or excuse me, I'm referring to the test, 4 tests.
Okay.
I'm sorry.
Okay.
But yes, he did also go into detail about the masks that the federal government is sending out, but that they haven't shipped, just like the tests have not shipped yet. So it's great to hear and to say that masks and tests are going to be distributed, but if they haven't been sent out yet, you may have to wait weeks to get it. It's hard to see what the purpose will be.
We have been talking in the last couple of weeks on this program about long lines at testing locations, and of course the shortage of home test kits that you can get at pharmacies and other places. On Wednesday, President Biden held a press conference at which he laid out his plan to make both test kits and masks available to the public. That plan is what? To post them on websites that you can go to, or a website that you can go to and then request them? Is that how it works? Anybody know?
For the test kits, yes.
Yeah.
So there's a website to the USPS that you can go and put your address in and request for up to 4 tests per household.
In the meantime, can you go to a pharmacy? Can you go to your physician and get these at-home test kits?
I think Walgreens and CVS, you still can, right, Joe? No?
Right. Yeah. They're hard to find
Hard to
still.
find.
And
Yeah.
I would encourage people to check out local pharmacies too, because some of them have at-home test kits, and the people might not be rushing into those areas because they don't know that they have them.
Since the federal government is setting up this website where you can request and receive these test kits if they are coming in any quick fashion, given the track record sometimes of things that are federal programs, and they're free. Can you go to a pharmacy and get these home test kits free, or do you have to pay for them?
No, you have to pay for them. They could be anywhere from $12 to $25. And now you can allegedly get them reimbursed through insurance, but I haven't heard from anyone who has successfully done that yet.
Okay.
Mike, I was just going to jump in with the rapid tests. I think one thing that's been interesting with Omicron is that, I kind of hear this anecdotally a lot in the community from, my kid's school nurse that the rapid test, that we take to kind of make sure we're quote safe, that we don't have the virus, that it's just not really or not often picking up pre-symptomatic cases. You be symptomatic with a sore throat and take a test and it doesn't show up. I mean, I think that Omicron has kind of changed a lot of the ability for the rapid test to detect early COVID or symptomatic COVID. It's just not a guarantee to let you know if you have or don't have it.
And these rapid tests, Steve, these are the home kits. Is that correct?
Yeah.
That's right. Yeah.
Yes.
So the other tests, these so-called PCR tests, are the tests being administered by healthcare facilities and other. Some of them are bogus, by the way. We talked about that last week. Some of them are being run by reputable organizations, but they take a while to get the results back. So is it better? Is the trade-off that you can get these home test kits, which may not be accurate, but they're instant. They're within 15 minutes of you taking the swab, versus these PCR tests for which the results are supposed to come back within 72 hours. But that's a long time if you actually have the virus.
And if
right?
you're sitting at work and you get an email saying you have the virus, and let's not forget that all of these tests are still around a 30% false positivity, false negativity rates. So that's why Joe said, we don't know who has COVID.
Yeah.
Right.
The PCR test really is the gold standard, and the government agencies doing these tests really have to get that 48 to 72 hour time frame figured out, because right now it's taking 5, 6, 7 days and it's useless. I know there was a reporter who just posted on Twitter that she got a rapid test. It was negative. She got a PCR the same day. It came back positive, because the PCR has the ability to detect those small amounts of the virus better than the rapid does.
Go ahead, John.
I mean, and to take that even further, I know of several people who had both a rapid and a PCR, had symptoms, and both came back negative. So that's why these health officials just saying, if you feel symptoms, just to stay home, because even if you get tested, it may not even give you an accurate result.
And then there's the problem with the PCR, the more accurate version of this test, with the results being delayed. Joe, South Carolina health officials have actually gone as far as apologizing for the delays in getting test results back in a timely manner. And they promised to hold vendors, the people analyzing the tests, hold them accountable. One of those vendors is also being, I think, used here in the Charlotte region. Did anyone offer an explanation for the holdup?
Yeah, so it's Premier Medical Lab based in Greenville, South Carolina, that is responsible for most of these delays. StarMed used them heavily, and South Carolina DHEC uses them for quite a few of their testing sites. Premier has blamed staffing shortages, technology failures, COVID, and an unprecedented amount of demand for the delays in getting these test results processed. South Carolina DHEC has said, if you can't process the tests on time, we will find someone who can. And StarMed has completely severed ties with Premier as of January 11th for Mecklenburg County tests and as of Wednesday for all other counties.
As distasteful as it may seem to some, and I hope nobody's eating breakfast at the moment, scientists and health officials have been testing wastewater to measure the prevalence of several different compounds and illnesses, and now COVID is showing up in our wastewater. What does that indicate?
We start shedding the virus through wastewater before we may show other symptoms. So wastewater is a good indicator of what is to come with COVID-19. In some parts of the country, like Boston, they're seeing the levels significantly drop, the amount of COVID in wastewater. The last batch of data came out a few days ago for North Carolina, and in Charlotte specifically, we are starting to see that leveling off now. So still a little bit to go, but the indicator in wastewater is improving.
So if you're a regular listener to this and other programs that do the news, you may think that COVID is never going to go away. Maybe it won't, but here's something else that may be with us forever, and that is redistricting, particularly here in North Carolina. New voter maps based on the 2020 census have gone to the North Carolina Supreme Court, and that will result, we presume, in yet another postponement of primaries for this November's election. I say presume because it's a little up in the air, a little bit. A history lesson, Steve. When were these primaries originally scheduled? How often have they been postponed?
So the primary was originally going to be in March. The state Supreme Court pushed them back to May to basically give them time to settle the whole issue of maps once and for all. The Supreme Court will hear oral arguments on the case on February 2nd. This week, the General Assembly passed a bill to push the primary back even more into the future, into June, because the Republicans in the legislature, there's a real, I think there's a real sense that the state Supreme Court will invalidate the maps. They want to have time on the calendar to redraw their own maps, to have time to get another crack at this. So that passed along party lines, the bill to push the primary to June. There's an expectation that Governor Cooper will veto that, and then we'll leave the date of the primary will probably be in the hands of the state Supreme Court. So that was a real headache.
This passed in the House and Senate on a bipartisan vote, but it was split along party lines. The Republicans said, let's delay. The Democrats said, let's not. The governor recommended that they not, and they do not have veto-proof majorities in either house. So the governor could veto this, and I suppose it could be overridden by the legislature afterward. But why does the governor want to go ahead with something that's in the Supreme Court, and the Supreme Court may tangle up the works even worse than it already is?
So there's a sense among Democrats that, part of it is that they feel like the courts should, since the courts kind of have all the cards in terms of, will the maps be legal? When will we have our elections? Why, the Democrats feel like, why should the General Assembly create another date for the primary that may also be not workable? So they're saying the Supreme Court is going to make the ultimate decision. Let them decide when we go vote in the primary. So
will this impact all elections in the state, including the already delayed city of Charlotte municipal elections?
That's right. So if you, that's right. So we don't know there, and of course, they were supposed to have elections back in November. They're on extended time because of the problems with the census. So their terms will most likely get even longer.
So these new maps that are now in front of the Supreme Court, the state Supreme Court, are there because of allegations that the new voting districts were politically gerrymandered, which may or may not be legal. At least at the moment, it seems to be legal. And also, they underrepresent the power of the black vote in North Carolina. Could this all have been avoided had Republican lawmakers learned lessons from the past, or is this something that we're doomed to repeat over and over again in North Carolina?
So it's a good question. Republicans felt like they were going to be sued basically regardless of whatever map they drew. If you look at the congressional map, their feeling was that unless they drew a map that was a 7-7 split between the two parties, that they were going to go to court, or that the Democratic aligned groups were going to sue them. They feel like a 7-7 map is a gerrymander the other way. So they felt like that this is in a way kind of all a big negotiation and a bargaining point. So they said, all right, well, our opening bid is a 10-4 map, and we will work our way down from there. It looks like they will have to give up at least one congressional seat, probably, to go to a 9-5, maybe more. So it's just kind of this, in a way, kind of trench warfare between both sides to try and come to, this final map.
Charlotte City Council this week made some rezoning decisions. One in the Ballantyne area. It involves a proposal to bring a new elementary school and a residential complex with 380 apartments and about 50 townhomes across the street, evidently, from Ardrey Kell High School. Evidently, one of the main problems here is Ardrey Kell Road, which is owned by the state. Why is that, Joe, a problem?
It's a very small road, and it is a disaster when school is in session, especially dropping off, picking up people. But this road, it's owned by the state. It's not going to be widened until the 2030s on NCDOT's current timeline. So who knows how long that will take. But then you're adding in hundreds of housing units across the street and another school. Neighbors think that this project is just too big. So I think what we're going to see is the developer go back to the drawing table and perhaps reduce some of the housing units and try to find 6 votes on city council.
And Dawn Anderson is one of those neighbors. She lives in a neighborhood near Ardrey Kell High School, and she spoke before city council this week.
Let's make Charlotte a better place to live for our generation and future. And let's really think about, what we build before we build it.
So the council heard from both sides on this, the neighborhood people who are against it and the developers who are obviously for doing this. What did the other side have to say about this?
Well, we need housing. And this is a neighborhood that will have 10% of the units be affordable in a very great location. So this could be a nice spot for teachers to live because they're in walking distance to 3 different schools, including this new elementary school. We're in such a housing crunch right now. This is one of the last remaining plots in Ballantyne that you can build housing on. So they're trying to make this development work for everyone. Of course, schools are desperately needed in Ballantyne. They're bursting at the seams as is. It's just a really tight timeline. Voters approved the money for this, and they were promised this school in fall 2023. So they would have to start construction in the spring. So, and Ed Driggs right now isn't on board with the project. So there's just a lot of things going on right now. I'm not sure if they will get there in the next couple of months without some major changes.
We'll talk about Ed Driggs in a second, and also some of the other rezoning issues that City Council took up. And we must mention and talk about 5G. Oh my goodness. It's Charlotte Talks on WFAE. Support for Charlotte Talks comes from WFAE members and Atrium Health, dedicated to promoting better lives through better health with comprehensive care focused on overall wellness. Atrium Health. The post-holiday Omicron wave seems to have crested around the country as case totals in states are beginning to fall. COVID-related deaths, however, are still high, totaling about 2,000 people a day. The Democrats fail in the Senate to pass voting rights reforms and end the filibuster, and the Supreme Court has cleared the release of documents from the Trump administration to the Congressional Committee investigating the January 6th insurrection. Those are just some of the stories They'll be talking about in the national news roundup, which follows this program in 20 minutes at 10 o'clock on 1A. And we'll continue our look at the week's local stories when we come back in 30 seconds. Stay with us.
If more exercise is at the top of your list this year, WFAE's Charlotte Walks will keep you moving. Run, walk, cycle, or roll in our virtual step challenge, now through February 6th. Registration and information at WFAE.org.
It's Charlotte Talk on the local news roundup on listener funded 90.7 WFAE and 90.7 WFAE and 90.3 WFHE. I'm Mike Collins. Steve Harrison is here. He's our political reporter for WFAE News. Joe Bruno, reporter for WSOC TV. Jonathan Lowe, reporter anchor for Spectrum News. And Seema Iyer, chief legal correspondent for WJZY Queen City News. We were talking a minute ago about the Ballantyne rezoning issues involving Ardrey Kell High School and a development that they want to put across the street from it and some of the opposition to it. And the fact that the problem is it's on Ardrey Kell Road, which is a state-owned road for which there is no improvement scheduled until 2030. And this would all begin within the next 10 years. So it could exacerbate problems that already exist. And Republican Councilman Ed Driggs admitted that it already takes ages to get through that area because of traffic. But I read that comment and I thought to myself, has anyone on council looked around town at what growth and development and what they've allowed to have happen with rezoning and the strain that's putting on infrastructure already that is also not being improved? Is anybody looking at that? Are they just noticing this now?
I think it becomes more visible on certain projects than others.
Okay. You're being diplomatic.
Yes.
So on a 9-2 vote, Charlotte City Council did approve a controversial micro apartment development in Noda. I think micro apartments are really tiny units. I mean, with like maybe one bedroom and studio apartments.
Yeah.
And there's already one in South End. This would be for Noda. Why is this project controversial?
Well, because residents over in that area have been fighting this since the summer. Miranda Whittington at Spectrum News, she's been covering this a lot. And she talked to one lady over there, Candace Oliver. She had 300 people sign a petition concerned about the scale of this project. I think it's like a 5-story building. And the amount of units was a concern that, you know, basically said, we're not South End. We don't want these high density, high rise apartment buildings. And so this really turned into a back and forth between several city council members because the developer Accent Real Estate Capital over the course, because city council has deferred this and they wanted to see that the developer make some changes, which they did to some of the infrastructure, stormwater improvements. And so some of the city council like Julie Isolt were saying it would be disingenuous for us to see them make all these changes and then to not approve the project or the rezoning.
It's the complex calls for more than 211 units plus 11,000 square feet of retail space on 36th Street between North Alexander and North McDowell. Joe?
Yeah, council is setting a precedent here that this kind of development is acceptable on 36th Street. It will be right next to Mercury Noda, which is a similar complex. And they really like that ground floor retail is included on this. This is the same developer behind the Centro Rail Yard where North Italia and Stir is in South End, if you're familiar with that. The developer went and cut the pool out of the project. They're going to try to save a couple of ancient trees that are on the site. But what council is saying here is 36th Street, it's appropriate for this kind of development. If this was on 35th or 34th in the more residential parts of Noda, it would be a tougher sell.
And I know that area residents are concerned about this ongoing development in that area and what it's doing to the character of that neighborhood. But the character of that neighborhood has changed substantially over the last 10 or 15 years. And didn't they anticipate further acceleration of the change in character when the blue line went through this area? Wasn't this inevitable?
Yeah, I mean, that's what it's called, transit-oriented development. That's what the city is aimed at doing with the light rail line, and spurring, jobs and, places to live, walk, and play. And so, yes, it's inevitable that NODA is going to see something similar to what has happened in South End.
And on an 8-2 rezoning vote, Charlotte City Council approved Fifth Third Bank's request to build a new branch around Woodlawn Road and South Boulevard, which would include a drive-through in a very busy intersection. Does this approval set the stage for proposals for Chick-fil-A and Bojangles to tear down a building next to each other, tear down buildings next to each other on Randolph Road, and replace them with drive-through only restaurants? And if so, does this fly in the face of all the plans that Charlotte has been talking about that call for the city to become less car-centric and more walkable?
I think, yeah, to Mike, your questions, I think yes and yes. Whereas those NODA apartments were very consistent with the city council's vision of a more dense city and the 2040 plan that was passed last year. That was consistent. A lot of people say that the drive-through votes are not consistent, and that we want to become a more walkable city. There was another rezoning to tear down and rebuild a Chick-fil-A on South Boulevard at the end of the blue line. That also passed. So yeah, there's this, I think kind of the common denominator is that the council side with developers on both occasions. Sometimes what the developers wanted matched up with the 2040 plan, sometimes it didn't.
And I just want to point out, I mean, that's the problem, right? Is that when the politicians are siding with the developers, like who is siding with the residents? There is something about, this country was built on our individual property rights. I mean, everybody has that. And to relinquish those property rights for development and then lose the character of your neighborhood, the environment gets affected by losing so many trees. And, people, they're getting pushed out of their homes, and we see this all over the country, and that's what Charlotte's trying to do, it seems.
Speaking of car-centric versus walkable, transportation is becoming increasingly important in the Charlotte region because you can't build roads fast enough, and we have all these transit plans that are kind of in limbo at the moment. But yesterday, or Wednesday rather, was the first day of North Carolina's Department of Transportation's State Summit on Transportation. Most people know very little about this, Seema, but you seem to know a lot. What has been happening in the last several days?
I only know a lot because we have a transportation correspondent, Hawker Vanguard, and he went there. So basically, this was a big deal because in 2020, they had over 1,000 transportation people from all around the country going there. So they went back there. They got a good turnout. Big picture is that they want Charlotte to become a hub of transportation and make it more easy to not have to have a car, like we're talking about walkable, and not even fly places. They've got $100 million in federal funding that is supposed to go into this transportation hub. That would be for the light rail, for Amtrak, and for Greyhound. And I think that would be in the uptown area. And that's part of what they're trying to do, at least for the next, I think the prospect is within 5 years. And another good point, there was a lot of talk about sustainability, is to kind of make everything more sustainable, more green, more environmentally friendly. So that was a good point. But that's what we're seeing in the next 5 years. And and the Amtrak, what they're trying to do is get, I guess, from Charlotte to Raleigh and Charlotte to Atlanta, which would be great.
If anybody flew over the holidays, they all know about the thousands of flight cancellations that plagued holiday travelers. That was followed last weekend by flight cancellations all over the country, but particularly at Charlotte Douglas because of snow. And then some flights to and from the U.S. were canceled on Wednesday because of AT&T and Verizon's rollout of new 5G cell phone technology. Some airlines contend 5G towers close to the airports could cause catastrophic damage. Captain Dennis Tager from the Airline Pilots Association is among those who are concerned.
Not on my watch. You're not going to put my 170 passengers plus crew into a test airplane and see what happens.
This fifth generation cell phone technology has been in place in other countries for a while. Have there been problems in those countries?
I have not read of any, and I've been keeping up with this. This launch of 5G, though, it's the concern around it and among pilots and pilot unions started about 3 or 4 months ago, and it reached the levels of the FAA. The FAA started to take a closer look, and it really came to a crescendo earlier this week. But as to your question of hearing of issues, I just know that there was concern in other countries, and there were flights that were canceled to the US out of concern. But as far as issues, I haven't read much about that or seen anything.
And we've known about the 5G rollout for a long time now, and it came right down to the deadline. I think on Tuesday night or Wednesday morning, the phone companies and the airlines came to some sort of an agreement, and the agreement was that the phone companies involved would turn off 5G essentially within a 2-mile radius of airports around the country, including Charlotte Douglas. WSOC TV, Joe, sent one of your anchors, John Paul, around the city to see where he could get 5G signals. And he got as close as 1 mile from the airport on the Billy Graham Parkway. And although he couldn't get 5G on an AT&T phone, he could on a Verizon phone. Is that buffer in place and working? That is the question.
So the AT&T and Verizon said they would reduce or eliminate the signal. And I'm wondering if Verizon is on the reduce side of things, because Billy Graham and Wilkinson Boulevard, as you said, John Paul went there and he still got a 5G signal. And he even went to the airport and he said that Verizon still had a 5G signal showing. So has reached out to Verizon. I'm not aware if they have responded to his request. It's interesting, but I will say we didn't see the major catastrophic issues that pilots were predicting. It's really tough to say whether any flights at all were impacted by this in Charlotte. I went to the airport the morning after. I saw a couple regional, delays. A flight to Harrisburg was delayed by 2 hours, a flight to Indianapolis by 45 minutes. So it's possible maybe this is why they were delayed, but there wasn't huge swaths of cancellations or delays.
There was only 15 cancellations. That's it, 15. They thought there was going to be hundreds. It would be debilitated.
Well, I think part of this, Mike, is no one really knew until we were in it what the level of whether this buffer zone at these 50 airports was truly going to work. It is kind of concerning, and I understand as someone who's learning about flying planes why pilots were concerned, because this could impact, especially in situations where they rely on instruments to land the plane safely. Why they were concerned about how this might interfere with certain instruments that they use in the cockpit. So
some of the concern I think is being amplified, correct me if I'm wrong, by the simple terminology, 5G. It sounds like something scientific, when in fact 5G simply means the fifth iteration of cell phone technology. Right now we're on 4G. Before that we were on 3G. So people that look at 5G and they think this looks like something out of a conspiracy theory. And some people do think that. They think that in countries that have already rolled out 5G, that the COVID virus spread more quickly in those countries using the 5G phone system, which is just ridiculous on the face of it. And it seems to me this is not unlike what we went through when the clock struck midnight on 2001, and people thought that all the computers in the world would stop working because they weren't equipped to go past 2000. Is there some truth to that this is just being blown out of proportion?
Not when you're talking about radio signals. And that's what this 5G essentially turns on, certain radio signals to give us faster coverage. And so it is conceivable that those radio signals, which is along the same bands that altimeters use. There are technical aspects of the concern that, I certainly understand why people were saying, 5G may sound cool, but it does rely on true technology.
Finally, this morning, the town of Indian Trail lost their mayor this week, Michael Alvarez. first elected in 2011, was serving his third term in office when he died after battling angiosarcoma. He was on this program back in September with Ron Pappas, the mayor of Waxhaw. And he spoke then about his philosophy of working with other area towns.
The key to the future is collaboration with the surrounding communities. You get more as a group and more bang for your dollar than you do on your own. And Union County didn't have a good history of towns working together. But I would say, Ron, over the last year, we've been doing a good job working together, our town managers. Mayor Ron and I have met on a couple of occasions and just trying to pull in the rest of the county to see what resources we can pull together to, what affects Waxhaw affects us.
So those who knew him, Michael Alvarez, said that even during his toughest battles with health, he never stopped working for Indian Trail, and he approached every challenge with courage, kindness, and humor. And that came through in September when I asked him to tell us how he pitches Indian Trail to those who might want to locate there.
Well, we have a great park system that they're slowly increasing access to recreation, outdoors. We're a community that's coming into our own to make it a work, live, play here type community. Our low taxes and that small town feel, that being so close to destination points such as the mountains, the beach, Atlanta, and if you must, drive into Charlotte.
So Atlanta gets top billing over Charlotte. We'll leave
I
it
think
at that.
sometimes it's quicker to get to Atlanta than it is to Charlotte.
Indian Trail Mayor Michael Alvarez was 52 years old. Well, that's the end of we have no more time. Well, we do have a little second. We have a second here. LaMelo Ball. He had a triple-double on Wednesday night. This is what it sounded like.
LaMelo! Huge shot for the 20-year-old!
There you go. You can relive the moment anytime. Thanks to all of our correspondents here. Steve Harrison from WFAE News, Joe Bruno from WSOC, Seema Iyer from WJZY, and Jonathan Lowe from Spectrum News 1. Thank you all for the hour.
Charlotte Talks with Mike Collins is a production of 90.7 WFAE. Support for Charlotte Talks comes from Mazda of South Charlotte. Our executive producer is Wendy Herkey. The senior producer is